Welcome back. And you are?
I'm Jeb.
Jeb, nice to meet
Dustin's
you.
brother.
Nice to meet you.
Thank
Pleasure,
you.
pleasure. Hey,
Thank you.
Dustin, good to have you again, man. Welcome back. So, thanks for coming in today. What we did yesterday, we went through a couple examinations. We talked about what's going on with you. And here's the question you're probably asking yourself: can we help you? We can absolutely help you. Went over all your exams, everything that was going on with you, and you came in because you were having these headaches, right? It's horrible headaches. They come and go. It's a consistent condition that he's been having. I'm sure he told you about all that.
Yes,
Oh,
I
they're
did.
bad.
Yeah, they're brutal, man. I mean, and luckily, fortunately, we see a lot of these cases in our office, and we've helped a lot of people. And it's been very consistent in the treatment that we do, and the results are also consistent. So, what's going on is, we talked about this yesterday, Dustin, I don't know if you had a chance to talk to you about it, but we as chiropractors, what we do is we detect, correct, we assess subluxation. And subluxation is a fancy word. It almost sounds like dislocation, but it's just right below that. Sub means below. So it's almost like the bone was dislocated. So like right here, if you look at the spine, this is actually the front part of the spine. I'll turn it around a little bit for you. And these are all the vertebrae that are in your spine, right?
Right.
Cervical, your neck, back, lower area, your lower back. So what happens is sometimes these vertebrae get kind of misaligned, is what we call it, causing a subluxation. What happens is that these nerves come out in between these, and they get pinched, right? So it's very similar to like when you're vacuuming. You're vacuuming your living room, everything's fine. It gets caught on the leg of the sofa, and it stops. It unplugs it from the wall. So you have to go back, reline it up, get going on your vacuum.
Okay.
So that's exactly what's kind of going on with the
Okay.
nervous system. So, like I mentioned before, we as chiropractors, we assess the nervous system. We find that the nervous system is the most important part of your body because it controls everything, right? It controls your heart, controls your heart rate, controls your breathing, digestion, all these great things that Dustin and I talked about for a little while yesterday. I also gave him a couple of things to take home, to take a look at. So what's going to happen is, I'll actually give you, this is your report of findings. This is everything that we found yesterday. It's going to have your treatment plan. It's going to have everything that's going on, how much it costs. But really quick, I'd like to discuss that with you. Is what's happening with your neck is because of your jaw position that you have something that we call forward head posture, which just means that your head has kind of gone forward. What that does is as you can see right here, you have a curve in your neck, right? You've actually lost a lot of that curve. So that's causing.
Is that on my x-rays?
Yes, we went to the x-rays, we checked all that out. We also did some orthopedic examinations, some neuro examinations as well. So what we found in the x-rays is that you have a straight neck. And that's kind of common, and it can cause what we call cervicogenic headaches. Cervical means your neck, cervicals again, and genic means it's generated there, so it's made there. So because of these overactive, we call them hypertonics, there's a lot of tone. Because of these muscles in your neck, it's causing that straightening of your neck, which in turn causes these headaches. So what we're going to do is we're going to restore that curve. We're going to do this through a few ways, kind of a trifecta, if you will. First thing we're going to do is, like I mentioned before, yesterday, as chiropractors, we adjust these subluxations. We're going to do the adjustments. That's the most important thing that we do here. And to start off, we'd like to see you 3 times a week. We found that this is the most beneficial for the patient to come 3 times a week to restore that curve in your neck. We're going to start off by doing it for a month, 3 times a week for a month. And we're going to also do some modalities. These are some things that can help stimulate the inflammation process, can help stimulate the pain that you're feeling. So that's all going to be included in the price. So that's the next thing I'd like to talk to you about is just how much this is going to cost. So the first visit's a little more intensive, a little more, we're going to show you, how the equipment works, how the adjustment works. We're going to go through everything in detail. We're also going to do the modalities on you, so it's a little more expensive. It's going to be $100 for the first visit, and then each visit after that, like I said, we're going to see you 3 times a week, is going to be $40 a visit. So this kind of grand total for the first month is going to be around $540. In addition, I'm going to give you a couple things actually right here, a couple exercises for you that I'd like you to do at home. A little bit of homework. Nobody really likes homework, right? So, but they're really easy to do. Basically what we want to do is your head has been in a flexed posture a lot because of your job. we want to get you to do some exercise that are going to have some extension, right? We're just going to kind of reintroduce those muscles in the back of your neck to lift your head back up.
Stand my neck like this? Or?
Yeah, it's easy. You can do it on your bed. You can do it. I usually recommend patients do it first thing in the morning. You can do it, right before you go to bed. It doesn't take long at all. Really good stuff, and that will help restore that curve that's in your neck. Right now it's straight. So I'm going to put this in your report of findings.
So just about, you want me just to flex, keep flexing my neck back?
We call it extension, but basically you're trying to put your nose to the ceiling, right? So look up as much as you can. And that, like I said, the very first visit, we're going to start. We're going.
He likes to make things difficult.
He does.
What he's trying to tell you is, you need to look up at the roof. Look.
Easy stuff. It's really that easy. And like I said, the first visit, we're going to go through all of that. And we have literature here for you that walks you through the process, right? And I'm actually in the picture, so I just showed you right there, and I've done these myself, and these are really, really effective. So that's the first thing we're going to do. And then for a month, what we're going to do is we're going to reassess what's going on with you. We're going to make sure the frequency's right. We can see if we can make it taper off to 2 visits a week, 1 visit a week, whatever we need to do for you. Because, like I said, this is a very common thing that we see, but we'd also want to make sure that we're assessing your needs perfectly. Because some people heal faster, some people don't heal as fast. So that's what we're going to do. And after that, it's very important to come see us. We're going to schedule you for what we call a wellness package. And this is usually once a month, twice a month to get the full benefits, but a good analogy of this is you don't want this to happen again, right? You don't want these headaches to occur. We're going to be preventative, right? We're going to take a proactive approach. Just like when you go to the dentist. You don't go to the dentist when you have a cavity, or when you have let me rephrase, you don't want to go when you have a cavity, you want to go before you have a cavity. So that's why you go every 6 months, right? For your cleaning, right? Treatment, it's a preventative process. So we're going to put you on a wellness plan. And after we reassess what's going on with you, so at the end of 30 days, we'll go through the whole process again, we'll shoot some x-rays again, we'll take a look at what's going on with you, and make sure the treatment's designed perfectly.
So the headaches themselves, are they from me sitting? What's causing me? What's actually
right?
making them?
Absolutely, great question. So like we said before, there are certain muscles in your head that can flex your neck, right? Ones extend your neck. So like I said before, it's hypertonic muscles that are causing these headaches. We term this cervicogenic headaches. It's a medical condition. It's actually something that the American Medical Association has said that we are the experts in treating. Subluxations can cause this, right? So it causes hyperactivity, too much overuse of those muscles, right? So when you're on your desk, typing stuff up, looking at your iPad, looking at your phone, it's a very common trend that's going on with everybody. So hypertonicity of these muscles, right? And what we're going to do is not only adjust your neck to put you back into the right alignment, we're also going to give you some exercises to do at home, and do some modalities just to recap to help with the pain that's going on with you. So we should see these symptoms to subside. So like I said before, we're going to make sure that we're getting the right treatment at the end of this, and we're going to go through and keep you on a wellness plan to prevent this from happening again.
So I have to come consistently just because I do sit all day long, and I have to sit because
right. See, and that's the problem, is that you didn't do anything traumatic per se, but we call these micro traumas. This is happening consistently through your life, and unfortunately, because you're sitting at your desk all day long, and that's what you do for a living, you have to do that. There's no way around that. We're going to do some other things in here. There's exercises, like I said, to take home. There's some ergonomics, which is just ways that you sit at your desk, things you can do to help with that situation. Get up and walk every few minutes. But like I said, I'm going to put a nice little package together for you that you can take home. That way you can take a look at it again, because there's a lot that we threw at you right now. Okay. So this goes home with you. Okay. Report of findings are all in there. Is there any other questions you might have for me? You have any questions, brother?
I got a question, Doc.
Absolutely.
So with the adjustment, you're basically taking the spine from subluxation to correction.
Correct.
By a force.
Right.
Is a force the only thing that can cause a subluxation?
That's kind of what I was hitting at before, is there's not necessarily a traumatic event that can absolutely cause a subluxation to you.
Maybe emotional?
Emotional, I mean, you name it. There's a nice thing that we say in chiropractic called the 3 T's, right? There's thoughts, traumas, and toxins. So thoughts is where the emotional part comes out. So let's say like he's having problems at home or at
Yep.
work, and he's really tense all the time. Your typical person, when you tense up, you go into the fetal position, right? Like let's say someone throws a ball at you, you kind of see it in your periphery, you go into tense, right? So if you're always constantly stressed, emotional, it can cause that subluxation for sure.
I'm telling you, get rid of that gal. She ain't close enough to talk.
That's right.
Yeah. Yeah, you know, that's a whole nother statement. I know a great psychiatrist down the street, man. I know a good singles bar too, so, you know. Well, let's get this taken care of first. Let's get rid of these headaches, and let's get you in a better, more wellness, chiropractic, healthier state of mind, and we'll take care of the little female in your life later.
That sounds good.
Right on.
Get you better.
Hey, thanks so much. Let's
you.
get started.
Thank you, Doc.
Hey, thanks.
Appreciate
Thanks
it
for
very
that.
much.
Thanks for the good question.